Hi, I'm talking today to holistic therapist Lauren Rosenberg. Hi, Lauren, how are you?
Hi, I'm okay. Hi, Joanne. How are you?
Very well, thank you. Lauren, today we're going to talk about OCD, Obsessive Compulsive Disorder. What is OCD?
OCD, in my own, definition, from what I've seen, it's the highest level of anxiety where the person is so anxious that the brain does not function properly, and it's sending you this message whereby you cannot stop yourself doing you have obsessive thoughts, and you can't stop yourself in having all those obsessive thoughts. So, like washing your hands, it's like we all have basically habits and things, but it's when it really gets out of hand. That is OCD.
What are some of the symptoms of OCD, and if I have these symptoms or behaviors, does it automatically mean that I'm OCD?
We all have habits and routine to help us to stay healthy. We wash our hands before eating, we lock the doors, we turn off the oven before leaving. But for people with OCD, those actions are more than just casual. When you suffer from unwanted thoughts, that cause them repeatedly, and people will repeat ritualistic behavior and routine, trying to ease their anxiety. So when they wash non-stop, or they go and have a shower and they can't stop and out of the shower, all they're trying to do is to release the anxiety. But obviously, once they're finished, they have the need again because they haven't dealt with the anxiety. So that's, to know if you have an OCD is the questions you have to ask yourself is, do you have unwanted ideas or thoughts? Do you worry excessively about dirt and germs? Do you worry constantly that something bad would happen? Are you afraid that you will act or speak aggressively the whole time, or that you can't concentrate? You want to wash your hand the whole time, you can't get off from the sink, or as soon as there's a little bit of water on your hand, you cannot stop. Do you keep many useless things to the point where you can't even move into your house? Those are the questions that you would consider if you thought that you had OCD. It's anxiety disorder, if you want, but to the highest level, because then the brain is telling you to do other things, which is, the way, just basically, the brain doesn't know how to deal with things, and that's why it's, the person is doing all those things.
How common is OCD?
Well, people who have OCD, they feel that the only one, the only one that have OCD. But OCD is so much more common than you think. About 2 in every 100 people have experienced at some point in their life, OCD. And some celebrities, they spoke about it, and they do say that they have OCD. It's a highly sensitive, basic topic. People don't want to say, I had OCD. To have OCD, you have to have a certain personality that you predisposed to OCD. Often somebody who is very keen, social, conscientious, highly sensitive to other people's behavior, extremely clever, and a perfectionist with a high level of anxiety, tendency to feel guilty also. This is, it's majority of the time, it's really people are very clever and perfectionist.
Is OCD, is it biological, is it physiological, is it both?
Now, OCD, in my own view, is that you're not born with OCD. You develop OCD as a fear. It is a fear, but to the point where you don't know what to do anymore, and you're so anxious that you're actually doing this obsessive thoughts and washing your hands the whole time. It's usually there's been a trauma in somebody's life that triggered and made them feel dirty, or something that made them feel that they have to wash their hands the whole time, or an event that made them feel guilty, and they just can't deal with the situation. Consciously they don't know about it, but subconsciously there is an event that triggered it at some point.
Is OCD curable?
Yeah, I mean, basically, a GP, I mean, what would do is a GP is likely to refer a person with OCD to a psychologist specializing in cognitive behavioral therapy. There are no medication whatsoever for this condition, although some medication are prescribed. In my own view, no medication will actually help. But with determination and by following a plan of action, sufferers will be able to reduce the symptoms and enjoy a better quality of life. Successful treatment involves, in my view, a combination of different therapy, EFT and other holistic therapy would help. Also, a lot of action plans. You need to, the brain needs to be busy so that so you get rid of this unwanted thought in the mind. And in the long term, success of this method is great because by tranquilizing the anxiety and going right to the root of what triggered it, and once you collapse the whole fear and anger or trauma, and you don't have the anxiety, then you don't need to have this compulsory disorder and having to do all these rituals.
If I have OCD, what are the chances that my children will have it too?
None. It's not genetic. They don't have. They may have a chance of develop a different anxiety or phobia or fear, but they don't have to. There's no. They will probably be very, very anxious, but no, it depends on what trauma they have in their life and how they feel and how they deal with anxiety, really.
What can family and friends do to help with OCD?
Well, family and friends are really the key to actually get a person better. I know it can be difficult, demanding and exhausting to live with a person who has OCD, and people may feel it's easier to help them with their rituals than to deal with the anxiety and the arguments if you refuse, because a person who has OCD, if you want to try to stop them to do their rituals, they can get really aggressive, and it's like a drug and you're taking the drug away. But participating in those rituals, responding to requests from reassuring and undertaking tasks the sufferer wants to avoid, may deal with the recovery. So you really should not go out and get more soap or wipes or whatever the person wants. You should really have a normal day-to-day life routine, and it shouldn't affect any other members of the family. And if there isn't any gloves or if there's no soap, well, they will have to deal with it, because if you provide all they need, then it's like a drug. You're actually providing the drug. So really, I know it's very hard, but the family really got to understand that they should not feed the OCD.
Thank you, Lauren. Thank you so much for talking to me today.
Thank you, Joanne. Have a good day.